The first line of treatment is generally the oral medication. We know these tablets as either Viagra, Levitra or Cialis tablets. Sometimes these tablets taken on a daily basis may expedite healing of erectile function. Erectile return is unlikely to occur if nerve damage is permanent, and these do need to be taken over some months or even longer. If a man wishes the return of his erections sooner than later, then penile injection therapy is recommended. Early studies show that this type of injection treatment also expedited healing of the nerves. These are vital nerves for the signal to go to the penis for blood to flow in. These nerves, the healing of these nerves may be improved by regular use of penile injections. The other advantage is an erection will occur with each use. Sometimes we recommend the use of vacuum erection devices. This can be used in two ways. Firstly, the vacuum device can be used to obtain an erection and hold the erection by placing a constriction ring at the base of the penis that allows sexual intercourse to occur. But the other use is when the device is used as a practice treatment about 2 or 3 times a week for about 5 or 10 minutes at a time. It stretches the penis and overcomes the contraction that often occurs after prostate cancer surgery. Older men tend to prefer the use of vacuum devices as opposed to younger men. Older couples are a bit more committed to the types of requirements around using a device. It does take time, it takes practice, but in the long term it can be a very satisfying treatment. An important strategy in sexual rehabilitation is that we encourage couples to continue with any form of sexual activity, especially if it is non-penetrative sexual activity, while the healing occurs. Any form of stimulation adds to the potential for recovery of erectile function. We call this outer course. This is the name we give to sexual activity that is non-penetrative. Or it may also be known as foreplay type sex. This type of sexual play is encouraged on a regular basis, whether an erection occurs or not. We believe it ultimately encourages healing of the nerves along with the other treatments that we recommend. Penile injection therapy is a successful treatment for erectile dysfunction that has been around for around the last 20 years. Initially, a chemical known as papaverine was used to obtain an erection. We now use a chemical known as prostaglandin. This was discovered in more recent times, successfully engineered and now available as a pharmaceutical treatment for erectile dysfunction. Prostaglandin comes in 2 forms. It can be available as a compounded medication, and that can only be made by a few selected licensed compounding chemists. It comes in a bottle of saline. It must be kept in a refrigerator. It is a multi-dose vial bottle, and a small amount is drawn up with an insulin syringe on each occasion. The other method is an injection known as Cavaject Impulse, also known as alprostadil, which is another name for prostaglandin. It is the same chemical. By injecting this chemical into the penis, vasodilation or blood dilatation occurs, and allowing an erection to occur. Cavaject Impulse comes in 2 forms, a 10 or 20 microgram dose. Cavaject Impulse comes in a few pieces. The needle has to be inserted onto the barrel or the syringe. The medication is mixed internally in the barrel by twisting this plunger. Air is evacuated, as in the normal fashion with a syringe. The dose is dialed with the plunger. There is a choice of 4 doses. In Cavaject 10, it's 2.5, 5, 7.5 or 10. With Cavaject 20, it's 5, 10, 15 or 20. In the case of prostaglandin from the compounding chemist, the bottle is taken out of the refrigerator. The top is swabbed with an alcohol swab. This very fine diabetic needle is inserted through the rubber stopper into the bottle. A predetermined dose, as advised by your doctor, is drawn out of the bottle. Usually more is drawn out than what is needed, so the air bubbles are removed and pushed back. The bottle is then returned to the fridge, and the needle is now ready for use. There are 2 erection tubes in the penis running along the top. This is where the injection is aimed for. The man should use his dominant hand to inject. If you are right-handed, inject the right side of the penis. If you are left-handed, inject the left side. The injection each time must be varied, a different spot every time. Otherwise, if you keep injecting in the same spot, there may develop a lump from chemical irritation. Please avoid the veins when you are injecting, otherwise a large bruise may occur. The injection goes in at what we call the 45-degree angle. This way it will penetrate the erection tube on that side nicely, and both erection tubes are connected, so you only need to stick to the one side of which you are handed. The injection must be pushed in quickly, not slowly. Then your thumb is brought up to the plunger and the plunger is depressed. Once the chemical has been inserted, take the needle out and put the alcohol swab firmly on the site of the injection for at least 1 minute. This may prevent bruising and scarring. We recommend that penile injection therapy is used no more than 2 or 3 times a week, and never more than once in 24 hours. The dose of injection used, whether it's with the compounded prostaglandin mixture or Caverject Impulse, should be carefully titrated and monitored by your doctor. We advise that the erection should last no more than half to 1 hour. Longer than 2 hours is called a priapism and may be a painful condition that requires treatment at a hospital emergency room. However, this is not a common occurrence, and therefore I always advise my patients to start with a low dose and build up slowly to the correct dose. Should a prolonged erection occur, then there is an antidote treatment known as pseudoephedrine. The trade name is Sudafed. Normally 1 tablet is taken for a head cold as a remedy. However, in the case of a priapism or prolonged erection, we recommend the taking of 2 tablets. This results in vasoconstriction or narrowing of the penile blood vessels and allows the erection to go down or detumesce. Penile injection therapy has a very high success rate. It often works when other treatments have failed. However, some men have a fear of this type of treatment, and counselling is required to help them understand the benefits and to teach them the best technique. A good technique will always minimise any side effects or harmful effects. If all other treatments have been unsuccessful, there is a surgical option, and that is the insertion of a penile implant. This device is inserted under general anaesthetic. There is nothing visible or external, it's all internal. The erection tissues in the penis are removed and replaced by inflatable rods. This can be a very successful device. It is usually reserved when all other treatments have failed. It is important that men should be open and discuss their sexual concerns after prostate cancer treatment. Men often feel distressed by the change in their sexual functioning. There are so many treatments that can be offered. Partners can be supportive. It's important to discuss this with your doctor and your specialist.